Good morning, Sophia. I'm Dr. Robert Miller, the physician who has been supervising your treatment since you arrived at the hospital 2 days ago. Before we begin today's examination, I would like to ask how you are feeling both physically and mentally, because recovery is not only about the body improving, but also about the patient feeling calmer, more comfortable, and emotionally stronger after a difficult experience.
Good morning, doctor. To be honest, I'm feeling much better than I was when I first came here because at that time I was extremely weak, exhausted, and frightened by what was happening to me. However, even though my condition has improved, I still feel tired whenever I walk for more than a few minutes, and sometimes I experience slight dizziness when I suddenly stand up from the bed or move too quickly.
That is completely understandable. And in fact, it is very common for patients to continue feeling weak for several days after suffering from a serious viral infection, combined with dehydration and lack of rest. Your body has been working very hard to recover, so even though the medicines are helping, your energy levels may not return immediately. The important thing is that your overall condition is steadily improving, which is exactly what we hope to see by this stage of your treatment.
That explanation actually makes me feel relieved because yesterday I was beginning to worry that something else might be wrong with me. Sometimes when patients stay in hospitals for several days, they start imagining negative possibilities, especially during the night when everything becomes quiet and they have too much time to think.
You are absolutely right about that. Many patients become anxious while staying in the hospital because illness naturally creates fear and uncertainty. People often start wondering whether their condition is more serious than they first believed. That is why doctors try not only to treat physical symptoms, but also to reassure patients and explain everything clearly so they can feel more confident and less stressed during recovery. Now, Sophia, I would like you to describe your current symptoms in as much detail as possible, because even small changes can help us understand how well your treatment is working. Are you still experiencing headaches, nausea, body pain, or discomfort in your chest?
The headache has reduced significantly compared to the first day, because at that time it felt as though someone was constantly pressing heavily against my forehead. Now the pain is much milder and only appears occasionally, especially when I haven't slept properly. As for nausea, I still feel slightly uncomfortable after eating large meals, but thankfully I no longer feel like vomiting the way I did before. My body aches have also improved, although my muscles still feel weak and tired.
That is encouraging progress because the symptoms you described are gradually decreasing instead of becoming worse. When patients recover from viral infections, the improvement usually happens step by step rather than all at once. One day the fever disappears, another day the headache becomes lighter, and eventually the appetite and energy return as well.
I noticed that yesterday evening I was finally able to eat a proper meal without feeling sick afterward. And honestly, that felt like a huge improvement because for several days I could barely finish a few spoonfuls of soup.
A returning appetite is often one of the strongest signs that the body is recovering successfully. When people are seriously ill, the digestive system becomes sensitive and weak, but as health improves, the body slowly starts demanding more nutrition and energy again.
Doctor, may I ask you something honestly? On the night before I came to the hospital, I became extremely frightened because I suddenly felt dizzy, my vision became blurry, and I almost fainted in the bathroom. For a few moments, I truly believed something terrible was happening to me, and I remember feeling completely helpless because I didn't know whether the symptoms were serious or temporary.
Of course you may ask me anything, Sophia. Situations like that can feel terrifying, especially when symptoms appear suddenly and intensely. Based on your medical reports and examination results, what happened was mainly caused by severe dehydration, physical exhaustion, high fever, and a sudden drop in blood pressure. When the body loses too much fluid and lacks proper nutrition, the brain temporarily receives less oxygen and energy, which can result in dizziness, blurred vision, weakness, or even fainting.
I understand now, although at that moment my imagination became much worse than reality. I started thinking about heart problems, dangerous diseases, and other frightening possibilities, because when people do not understand what is happening inside their bodies, fear can quickly take control of their thoughts.
That is extremely common, especially nowadays because many people search their symptoms on the internet and immediately assume the worst possible diagnosis. While it is important to pay attention to health problems, it is equally important not to panic before receiving professional medical advice and proper examinations.
Doctor, were there any concerning results in my blood tests or scans, or did everything appear mostly normal?
Overall, your test results were quite reassuring, which is very good news. Your lungs, heart, kidneys, and liver are functioning normally, and we did not find evidence of any dangerous infection or long-term disease. However, your blood test showed that your iron level is slightly below the healthy range, which may explain why you have been feeling tired and weak even before this illness began.
That actually makes sense, because over the last few months, I often felt exhausted after work, even on days when I had not done anything physically demanding. I assumed the tiredness was simply caused by stress and lack of sleep.
Stress and lack of sleep definitely contribute to fatigue, but low iron levels can make the situation even worse because iron is essential for producing healthy red blood cells, which carry oxygen throughout the body. Without enough iron, people may experience weakness, dizziness, headaches, shortness of breath, and difficulty concentrating.
Is low iron something dangerous, or is it relatively easy to treat?
Fortunately, in your case, it appears to be mild and very manageable. We will give you iron supplements, and I will also recommend several dietary changes that can naturally increase your iron levels over time. Foods such as spinach, beans, eggs, fish, red meat, nuts, and leafy green vegetables are especially helpful. Sophia, I would also like to talk about your daily lifestyle, because recovery does not depend entirely on medicine. Your habits, sleep schedule, stress levels, eating patterns, and hydration all play major roles in your long-term health.
I admit that my routine has been very unhealthy recently. I work long hours, I usually skip breakfast because I wake up late, and sometimes I drink coffee several times a day instead of eating proper meals. By the time I return home at night, I feel too exhausted to cook anything healthy, so I often order fast food and go to bed very late.
Unfortunately, that kind of lifestyle slowly weakens the immune system, even if the effects are not immediately noticeable. The human body can tolerate stress and unhealthy habits for a while, but eventually it reaches a point where exhaustion begins affecting physical and mental health. That is why maintaining balance is extremely important, especially for young adults who are constantly busy with work and responsibilities.
Listening to you makes me realize that I ignored many warning signs before becoming seriously ill. My body was probably trying to tell me to slow down and take better care of myself, but I continued pushing myself too hard.
Exactly. Many people only start prioritizing their health after experiencing a frightening medical situation. However, this experience can become a valuable lesson if it motivates you to build healthier habits in the future.
Doctor, how long do you think it will take before I feel completely normal again and regain all my energy?
Recovery time varies from person to person because every individual's body responds differently to illness and treatment. However, based on your current progress, I would say you should begin feeling significantly stronger within 1 or 2 weeks, provided that you rest properly, eat nutritious meals, drink enough water, and avoid overworking yourself.
That sounds reasonable. Honestly, before this happened, I never appreciated good health because I simply assumed my body would always continue functioning normally no matter how poorly I treated it.
That is a very common realization among patients after illness. Health is something many people take for granted until they temporarily lose it. Once recovery begins, they suddenly understand how valuable simple things are, such as being able to sleep peacefully, breathe comfortably, eat normally, and walk without weakness or pain. Well, Sophia, based on your progress today, I am pleased with your condition and optimistic about your recovery. We will continue monitoring you for another day, and if everything remains stable, there is a strong possibility that you may be discharged tomorrow afternoon.
That is wonderful news, Doctor. I truly appreciate everything you and the hospital staff have done for me because everyone has treated me with kindness, patience, and professionalism during a very stressful time in my life.
You are very welcome, Sophia. Remember that recovery does not end when you leave the hospital. Continue taking your medicines exactly as prescribed, attend your follow-up appointment next week, and most importantly, start treating your health as a priority rather than an afterthought.
I definitely will. After this experience, I think I have learned an important lesson about balancing work, rest, nutrition, and self-care instead of constantly ignoring my physical and mental well-being.
That is excellent to hear. I wish you a smooth recovery, and hopefully the next time we meet, it will simply be for a routine checkup rather than a hospital emergency.
I hope so too, Doctor. Thank you once again for your help and encouragement.
You are most welcome. Get some rest now, and I will check on you again later this evening.